Good morning. Our chairman, Melvin McLawhorn, is at home participating remotely for this meeting. And Mr. Chairman, if you'd like to call the meeting to order, I will turn the meeting to you momentarily.
Thank you very much. Can you hear me?
Yes, sir.
Yes. I'd like to call the meeting to order. At this time, we're going to ask Scott Elliott, managers, to take it from here in terms of bringing us up to date as to what we're going to be doing in terms of spending the money that was given to Pitt County. So Scott, at this time, we're going to ask you to lead us through the process.
Great. Thank you, Mr. Chairman. So the purpose of today's meeting, this is a special called meeting for Wednesday, May the 27th, and this is to review a spending plan proposal for the CARES Act monies that have been allocated from the federal government to the state of North Carolina to Pitt County in the amount of $3.1 million. We would like to do a roll call first to kick the meeting off. If the clerk would go down the...
Chairman McLawhorn.
Present.
Vice Chair Colson.
Here.
Commissioner Albright.
Here.
Commissioner Fitzpatrick.
Here.
Commissioner Floyd Huggins.
Here.
Commissioner Nunnally.
Here.
Commissioner Ward.
Here.
Commissioner White.
Here.
Commissioner Perkins Williams.
Here.
Thank you. So we have a presentation we want to provide to you. We have a PowerPoint we're going to put up on the screen. I do want to note that if at the end of this, if you were to direct us to go back and make changes, tweaks, adjustments to this, we can always bring this back on Monday, June the 1st. It's actually due to the state on June the 1st, but we really wanted you to hear and see this prior to that date. We really didn't want to wait till June the 1st to roll this out to give us a few days of the adjustments to it. So I think you should be able to see the presentation in front of you. Does the board see it?
Yes.
Okay, thank you.
No, because call in.
Okay, well, I'll be sure to read the screens to you, the slides. So the title of it is CARES Act Spending Plan Proposal, and this will be for Pitt County. In terms of the background on the next screen, we note that this is part of the $2.2 trillion Coronavirus Aid, Relief, and Economic Security Act that was passed by Congress and signed into law by the President back on March 27th. The CARES Act includes $150 billion in state and local aid, and North Carolina was allocated $4 billion of this $150 billion. The next point is that House Bill 1043, which was passed by the North Carolina General Assembly and signed by Governor Cooper on May 4th, of this, it directed the $150 million in immediate aid to counties with an additional $150 million put aside in reserve. Of this $150 million that has been allocated, Pitt County will receive $3,190,732 in aid to respond to the coronavirus and COVID-19. On the next screen, in terms of the federal state guidelines, the funds must be used to respond to COVID-19 issues per se. Permitted uses include personal protective equipment, otherwise known as PPEs, disinfectants, compensation for employees who significantly deal with COVID-19, actions to promote social distancing guidelines, teleworking equipment, testing, and compensation for employees out on emergency leave / emergency FMLA are permitted uses. And I do want to say in terms of these, basically the county would be reimbursed our dollars. The employees wouldn't receive additional funds if we were to go some of these routes. So it'd go to the general fund at the end. The next point is reimbursements of costs to municipal governments is permitted but not required. Offsetting revenue shortfalls is not a permitted use of these funds. So as we look at our sales tax projections, which I'll be talking about next week in the formal budget presentation, any shortfalls we have there, these funds are not permitted to be used to shore up the budget either for moving to June 30th or beginning July 1. Next slide are staff recommendations. First bullet, reimburse eligible expenses prior to receiving funds. Next bullet would be for use monies for personal protective equipment. Next bullet, use for equipment in teleworking and telemedicine. Next bullet, reimbursements of cost to municipal government partners, a portion. Next bullet, testing for vulnerable populations, which the board has had input on this. Next bullet, building modifications and disinfectant activities. Next bullet, personnel costs for employee leave, emergency FMLA, and staff who are substantially dedicated to responding to COVID-19. The next one, non-congregate housing expenses such as homeless. On the next slide, in terms of our year-to-date to county costs that we've had so far with the coronavirus COVID-19, Pitt County has incurred $244,937 in dedicated expenses to date responding to this coronavirus. The amount includes personnel costs for emergency leave, FMLA, teleworking equipment, PPEs, cost to shelter vulnerable population in hotels, social distancing barriers, and signage. Our year-to-date dollars do not include staff costs dedicated to COVID-19 response at this point, even though we have them. On the next slide is entitled Proposed Allocations. So we've got a number of allocations with the description, the amount of money, and then the percent. I'm just going to go down these from top to bottom. 10% is being proposed allocation for emergency employee leave. That's $319,000. The next bullet is 20% go to testing and testing supplies, $638,000. Next bullet, 2% for telemedicine at the health department for a total of $63,000. Next bullet, 3.15% for PPE or personal protective equipment of $100,000. Next bullet would be, I don't have the percentage on this, Brian, but $490,000 for facility cleaning, barriers, and building improvements. Next bullet is 15%. We're calling this the municipal allocation, $478,000. Next bullet, 6% going for personnel costs of employees substantially dedicated to COVID-19 for a total of $191,000. Next bullet, 0.5% improvements to telework, $16,000. Next bullet, 1.5% monies for detention center operations, $48,000. Next bullet, 1.5% non-congregate sheltering, $48,000. And the last bullet would be a 25% set aside for what we're calling contingency for non-foreseen costs, $798,000. That would be for the potential second wave of COVID if we have it later in this calendar year. One caveat on the whole $3.1 million is we have to have these spent by December 31st of 2020. On the next slide, we did reach out to the municipalities. We were asked to do so in terms of our partnering with them, and we sent them an email. We also on our weekly conference call discussed this, sent them a form to fill out, show them the categories that they could request money in, and ask them to have their requests in back into us by 5 p.m. last Friday. So on this chart, you've got the 10 municipalities listed, and I'll read the municipality and the amounts, and then the total of it all. For the town of Ayden, we had a request of $10,000. Town of Bethel, $320.22. Falkland did not respond. Farmville asked for $94,047. Fountain did not respond. City of Greenville asked for $1,566,580. Town of Grifton did not respond. Town of Grimesland asked for $700,000. The town of Simpson said that they would pass and let the county use the dollars for countywide purposes. The town of Winterville asked for $332,636.83. So for a total of all of the responding municipalities is $2,004,284.05. And keep in mind that our total CARES Act allocation for Pitt County is only $3,190,732. So on the next slide is entitled Next Steps. We would like to receive your feedback today on this proposed allocation. Again, like I mentioned at the outset, we have to respond formally by Monday, June the 1st, probably by the close of business hours on the 1st. If you choose to allocate a portion of these monies with municipalities, we would need to create an agreement with them. At the end of the day, Pitt County will be distributed these funds from the state of North Carolina. We will be responsible for every single dollar that is spent of these dollars to make sure that they are coronavirus appropriate or eligible. If they're not, Pitt County's on the hook for any ineligible dollars that would happen to be spent. So we're proposing that if you allocate any dollars to the municipalities, we would have a written agreement with them that basically says that if we're audited and their expense doesn't meet the eligible guidelines, they would then reimburse Pitt County for those costs. Next steps, okay, receive funding. Like I was saying, we're expecting to receive these monies. Brian, any? I guess it'd be 14/30. Okay. We'll have to submit progress reports to the state. We'll have to submit any changes to the state for approval. We have been told that the June 1st, we have to have our plan in, but it's not carved in stone. We can go back and make amendments to the plan once it is submitted, but we do need to get the initial plan in. And as I mentioned earlier, we're expecting some type of audit by year end, December 30th, but the funds do have to be spent before the end of the calendar year of 2020. So we as a management team and the health director, our emergency management director have met to discuss this. We've met for a good portion Friday afternoon to come up with this allocation list, to make this presentation this morning. And now I'd like to hear the board's feedback on this proposal. So Mr. Chairman, I will turn it to you. And I guess on the monitor, as we have hands that go up for input, Mr. Chairman, I'll make you aware so you can call on the individuals. Okay, Mr. Chairman, we have Commissioner White who's raised her hand, and then Commissioner Albright.
Okay. Can you hear me all right?
Yes, sir.
All right. Scott, I'm going to get to those individuals who had their hands up, but let me ask you this question here. Back to Grimesland, you mentioned 700,000. Was it $700 or what was that for?
What was it for?
I mean, what was the figure for Grimesland?
I'm sorry. If I said $700,000, I meant $700. I'm sorry.
I wanted to make sure that was correct. The other area was the fact of testing, and I think that's very critical. During the weekend, I think I probably had about 10 calls from both civic organizations and churches and communities, especially in the most vulnerable communities, Blacks and Hispanics. The testing was seen to be very critical. So I'm pleased to hear that we're going to, and I guess the question is are we going to have someone who will designate places that is convenient for the people to get to, within the projects area, those areas are located in those critical, most vulnerable communities. And we're going to have accessibilities.
Yes, if I can ask Dr. Servanel to come up and maybe he can give the initial thoughts on the testing plan that we've discussed.
Good morning, Mr. Chairman, fellow commissioners. The plan that we have presented to the manager includes placing 2 fixed sites, one at Moywood and one at the Greenville Housing Authority, and then a third revolving site, which would basically start in the Farmville area and then rotate around the county, moving sites every day. So we would hit Farmville, the Farmville Fountain area, we'd move to Bethel, we'd move to Grimesland, we'd move down to the Grifton-Aden area, come back up to the Farmville area and kind of rotate around that around the periphery of the county. The 2 sites within the city, if the demand was satisfied at those locations, those could be shifted to other locations within the city of Greenville. All other testing that's going on at the hospital, Invited Medical Group, ECU physicians, urgent cares, and other private medical practices would continue as well. The state recommends that we test about 5% of our population. That's roughly 10,000 people a month. We're over 100 persons a day between all of the sites that are doing testing now. With these 3 proposed sites, we would likely, if they operated at capacity, test something on the order of 150 people a day, which would get us north of 300 and approaching that 334 per day, which would put us where the state has recommended, and service the vulnerable populations at the same time.
And what about the homeless population, Scott, Dr. Sylvan? What are we going to do to deal with that? That is a critical area as well.
The other thing that we're going to do is to have an evening site at the health department on Tuesdays. We can work with Mr. James Rhodes, who has some inroads with the homeless community to get the word to those communities, and that mobile site could be set up somewhere near one of those homeless encampments to allow for testing of that population as well.
Okay, very good. Thank you very much. Scott, now who was next?
You're welcome.
You have Commissioner White up, and then Commissioner Albright, Nunley, and Floyd Huggins.
All right, Commissioner White.
Yes, sir. Scott, one, kind of couple of questions. So the municipalities, the total request from them is a little over 2 million. What's the total, when you add up everything that the county has seen as our needs? What is that total?
Brian, do you have that total? I don't think we totaled on the actual presentation sheet.
No, on the actual presentation sheet, I don't have the total, but Commissioner White, if you took out the 478,000, which is roughly 15% that we've allocated, that would give you the remainder amount that the county has put together as an allocation. So you're looking at $500,000 off 3.1. So you're probably looking about 2.6, 2.7, somewhere between there, million. Doing the math.
2.6 or 2.7 million. Okay. And Scott, did you say that if we did allocate money to the municipalities, that there would be some sort of contract or form for them to sign agreeing that they understand that the money is supposed to go to specific items related to COVID relief, and that if they don't use it appropriately, that they would be responsible for reimbursing the county, so that the county would have to reimburse it to the state?
That's correct. And we would also probably require them to submit have them make the purchase first, submit their to us.
Their receipts, and then we reimburse them for that.
Yeah, Commissioner White,
Okay.
the game plan would be for us to take their invoices after they've purchased. We would not be directly allocating to any municipality directly. It would serve more or less as a clearinghouse to reimburse them. So we would actually look at those invoices ourselves to make sure that they meet the requirements before we would actually send the money directly to municipalities.
And Commissioner White, the proposed total of all the allocations and the percentages is the 3,189,000, which is just like 1,000 below our appropriation. So it does total up to the total that we've been allocated.
Okay. And is there any sort of like formula or something that we could use based on population or size to say, to put into, I guess, evenly or appropriately distribute funds to different municipalities? So I know that a lot of these were requests for that, that way it's fairly allocated. One municipality is not getting so much more than another municipality, but we could do it based on size, population or something, or not.
Well, I think we need to keep in mind that the county government has the primary responsibility county-wide for this response. And that's why the state of North Carolina allocated these monies specifically to counties, but did ask them if we wanted to look at sharing some portion of it, we could. So, I don't know that per capita formula would work. If we did that, we would not have the monies we need for our needs in the county. And also keep in mind there's another $150 million sitting in the state that they are yet to decide how to distribute it to local governments. Municipalities may benefit from that as well at some future point.
Okay, thank you.
You're welcome. Chairman McLaughlin, would you like to go to Commissioner Albright?
Commissioner Albright, and then it's who was
Nunley,
next?
Floyd
Okay.
Huggins.
Okay, Commissioner Albright.
Yes, thank you. Thank you, Dr. Silvernail, for the plan. I appreciate all the work county staff has done in coming up with these proposals, and it looks very hopeful and extremely helpful. I did not see on the list of county expenses anything related to promoting social distancing, the use of masks. And I think that was in the list. I know that we're talking about a finite amount of money here. And I'm sort of moving the subject a little bit, but I wonder in promotion of social distancing and use of masks, if there has been any discussion about trying to coordinate a county-wide suggestion, something to help our citizens realize the importance of masking and social distancing. We're having some alarming incidents across the state, and I know this is sort of off the subject here, but it seems related to our wish to encourage appropriate behavior.
Sure. Commissioner Albright, if I can answer that in two parts. First, on the $100,000 we have for personal protective equipment, masks would be included in that category. We, in terms of county government, have came up with a plan in terms of social distancing, in terms of our conference rooms, our waiting areas, our auditoriums, our queue lines for if you're going to a customer service counter, whether it's the floor decals, signage and so forth, all that is included in these numbers. In terms of a mask requirement, you do have Commissioner Nunley on your next meeting on June the 1st has asked to have an agenda item on that agenda where he would like to discuss the topic of face coverings or masks. And I would defer any further comment until he makes his presentation to you Monday, June the 1st at 9 a.m.
Okay, thank you. How about the signage for encouraging outside the county offices? Are we doing anything further to encourage this distancing and masks?
Well, I mean, we have our website. We have our we just concluded our 18th or 19th press conference that we had with the media, where we continually were encouraging that. We're now having Dr. Silvernail is now hosting at the health department a weekly call in or meet the health director for any questions or updates regarding it. Other than that, I mean, we are using our website resources per se.
And Commissioner Albright, if I can chime in on the presentation. So I had to put these into categories and signage. If you could see the spreadsheet that I have, which you can't see now, but if you could actually see it, you would see that signage actually falls into several of the different categories. But I don't have a direct dollar amount, but that is part of the plan that we internally as staff met last week and talked about, making sure that we had social distance signages within our county facilities, but we were also looking to recover those costs using this CARES Act money.
Thank you.
Chairman McLaughlin, next we have Commissioner Nunley.
Okay, Commissioner Nunley.
Thank you, Mr. Chair, and thank you, Scott. And this first question is for you, Scott. This is on the municipal request, and it really just has to do with, I guess, like to hear in your view, you've seen the requests, and I wanted to know if those requests are tied to specific bullet points to date from the municipalities, and whether or not if you see if they're, those requests are really meant to overlap kind of belt and suspenders for the municipalities, so that they've got areas that maybe we're not covering. They feel like they need to put some increased need on it. Is that kind of the way we're thinking about this here? Or they're, trying to find the most efficient use of funds, and I guess some clarity there with the idea that they're actually bringing invoices to us to seek reimbursement. So there's some control there. But I guess the question is, in your view, are we going to be covering most of this? And those municipal allocations, are they really just kind of the suspenders? If we're not covering it, this allows them to kind of actionable responses as needed. Is that kind of your idea here?
I'm sure the municipalities would say that their expenses are just as real as ours, and that, they did use our guidelines filling it out. Greenville did an extensive job, department by department by department, in terms of detailing any and all costs out compared to I think the other municipalities pretty much used the one-page form we provided. Got a great amount of detail from the city of Greenville to delineate their $1.6 million of costs. So, and obviously the allocation being proposed of 478,000 at 15% only begins to even touch a portion of Greenville's, but this allocation will not meet everybody's needs. And at the end of the day, you may decide you want to have more dollars allocated to testing. We may have testing in the first phase go through, and you may find, and testing is a activity that's countywide. We're not just testing in the unincorporated parts of the county. We're testing countywide.
So, so I guess, and Brian, maybe you can chime in on it, but to the extent, I guess we're getting at needs, and to the extent that we're covering the bases that we're responsible for, municipalities are obviously going to have some, presumably there's some overlap there. But I guess in parsing out these funds, maybe it'll help clarify some of the additional needs that are not being fulfilled by the CARES Act. So if there needs to be a stopgap measure, maybe it'll provide a little more clarity to the state and to the Fed. Do you think that's something that we'll see as we're starting to, I guess, parse out the levels of management here?
As we communicate our plan back to the state on June the 1st, we can make it known in that plan that we had requests from our municipal partners that far outweighed our ability to meet those needs financially, and maybe send that message to the state. So as they're contemplating the next $150 million to be dispersed, that they would just take that into consideration.
And I would add, from a technical standpoint, when you give us $3.1 million that I have until December 31st to spend, if you notice that we set aside 25% from the start as a contingency base for the unknown, when you take the municipal considerations into effect, we have to make this money stretch.
Right.
So the state has given us the flexibility that if we start to see the need to spend money in one category over another, we can resubmit back to the state and make changes. So with our municipal partners, it's good to have a starting block, but we also have to look at this as a long-term oversight, just like we would a regular budget over, in this case, a 6-month period. So starting off with the 15% that we've set aside for municipalities, if we see that a need to adjust that, obviously we can bring it back and we can submit to the state to make adjustments.
All right, thanks you too. You guys, this next question, anyone can address it, but it really, I think probably Dr. Silvernail, in regards to the expectation, kind of, I guess, battening down the hatches and being over prepared for a second surge if we got one. What are we doing? And maybe you can speak to it, Dr. Silvernail, but obviously testing has to be smart. We have limited finite resources. What do you feel that the allocation that we have for the testing, and with contingency in place, that will be in a place, I guess, reasonably speaking, in a place where you feel that we will be able to respond as necessary? Obviously, our numbers are hopefully will stay low, so we don't need as much. But do you see that? Do you feel like we've got enough allocated that we can ramp up if necessary and get a lot more in place?
Yes, Commissioner. Most of the expense right now is for the actual tests. The labor costs to run the testing sites is a relatively small percentage of that. Our cost right now to do these community sites is largely the cost for LabCorp, which at this time is $100 per test. So when we look at the total cost per test on this, we're around $133 per test. So roughly $33 is labor and supplies. And the supplies, the state is furnishing supplies for much of this. They've received a large allotment of swabs and transport media, and they will provide us the materials to do the collections. The largest part of our cost is the lab processing fee. And so we're looking for other more cost-effective ways to do that. At some point, I'd love to bring this testing in-house. have our own molecular platform in-house, both for COVID and other illnesses like this, and also for some of our day-to-day testing, such as STIs, which would facilitate the treatment of patients for all the conditions we see at the health department. So if we're able to do that, we're always looking for ways to stretch our budget, and if we can find a more cost-effective lab vendor, then that budget will go further. But I think the infrastructure will be there to test as we go forward, between what is available in the hospital medical community, the university medical community, and then the broader medical service community, and then what we're offering as the health department. I think there'll be a wide range of testing capacity there. The university, I'm involved with their reopening plans and their look at how do they keep their students and faculty safe. And they're also looking at having a testing program on the university campus for faculty and staff. So that will also be available when that group of individuals come back to the community. And I think that'll help us going forward as well.
Okay, thank you. And I guess last question, it has to do with the non-congregate housing allocation. I think it was 48,000. Wondered how so far, I guess, in-house we've conceived those funds being distributed and I guess standing up and really connecting with those populations, and seeing as how it's really difficult to often as transient they are. But what just to hear a little bit what's behind that 48, and you know, are there people on the ground that are helping with that?
Yes, sir. We've had a group together, a committee working on this probably the past month for the homeless. We actually stood up the group in terms of, we actually had initially FEMA dollars come down that would allow us to put up under certain circumstances, folks who were either tested positive for COVID or had related conditions per se in their household. We've actually have seen little response on this. I think last week we had maybe a population of 6 people on about midweek, but in terms of what we've had to expend on this so far has been very limited. This may be an opportunity in this pot of 48,000 to reallocate this as we move forward. But in case there was a surge in homeless being positive or having qualifications to go into a motel room per se, we want to have allocation there.
So I guess just to clarify, I think that you answered my question, but these funds are to put people that are currently in shelter that test positive into alternate shelter. These are not funds that are being used to stand up additional housing due to reduced capacity because of response to the COVID crisis. Is that correct?
I mean, you could either be in a shelter today, test positive, or you could be in a household and have to leave the household or be asked to leave the household and then become homeless. So it could be used in that instance as well.
Okay.
Whatever condition would cause you to become homeless per se.
Okay. So we could presumably use funds for this and be reimbursed if the need arose to have additional temporary homeless shelters. Due to the response, we could presumably be afforded reimbursement for it.
Yes. So right now the plan would be to utilize motel rooms for these folks.
Okay. Thanks. That'll be it.
Okay. Chairman McLaughlin, we next have Commissioner Floyd Huggins, then Perkins Williams, and then Commissioner Ward.
Okay, Commissioner Floyd Huggins. Commissioner Floyd Huggins.
Can you hear me?
Yes, ma'am.
Okay, all right. Thank you, Mr. Chairman and Scott and Dr. Silvernail. Some of the questions that have been asked are kind of what I had to ask. Chris talked about overlapping, and I was thinking how much could be overlapping. Of course, I was looking at duplication versus what we do and what the municipalities do. So, and then I'm concerned that when the request came in from municipalities, I'm sure, and I hope rather, there was a action plan with those requests so that the county can see what they're doing and what we're doing. So to see if there's duplication. So I like the idea that Albright talked about language and verbiage and whatever. I think we need to put forth a program that will educate the people in the county, or encourage them to do more social distancing and face masking. I would like to, maybe I'll stop there and see if you want to comment on anything I've said so far.
So again, I think we do have this, the topic of the face masks on the agenda for Monday that can be maybe dealt with at more at length, but this, you can use a portion of these monies for a public education campaign if you want billboards or newspaper ads or something to further educate the public about appropriate social distancing. We could do that as well.
So when the request from the municipalities came in, did they present an action plan, how they plan to use the money?
No, the form we were provided was just to ask them by category, whether it was the personal protective equipment, whether it was salaries that were substantially dedicated to a COVID response. That is basically what we asked them back for. But again, we had a very short time frame on this in terms of when we were notified by the state and then asking the municipalities at the same time. And I do want to say we have already utilized billboards. Our public information office has used electronic billboards since the midpoint or beginning of our COVID response to promote our own website for the public in terms of frequently asked questions or the whole litany of information we keep on our website that's dedicated to this response.
Do you think that we have allocated enough for the things that the county is responsible for?
Yes, ma'am. I mean, I believe so.
Okay. Now, I would like to see more allocated to testing. I believe it's 20% allocated for testing. Maybe another 5% there. And leave 20% in the unknown category there. And I have a question for Dr. Silvernail about what I read in the paper that the state is hiring people to do tracing. And I believe that's community tracing, collaborative, community care, and the North Carolina area health education centers. The money that they are spending to do the tracing, is that separate from what the 3.1 the county is allotted?
As far as I know, it is, ma'am.
Okay, so we're gonna have that group in to the county also doing tracking or tracing, whatever, along with what the county is doing. Is that what I'm hearing?
They will be, the idea behind this is that they would be folded into the health department workforce. They are being hired through CCNC, Community Care Network of North Carolina, and then trained by the AHEC system. And then the state has been divided up into 10 contact investigation regions. And these folks will be supervised by a regional supervisor and made available to the local health departments to supplement the staff of the local health department. So there will be coordination with the local health department. And then the state is also going to provide a contact tracing software that can be used by these individuals and local health department staff.
So do you know who is the regional director for Pitt County with that group?
I don't know if that person's been named yet. The state has been a little bit nebulous in providing information back to us. I saw something yesterday where we are the third region, I think, that will receive resources through this. But they did not provide names. They just put a list of counties in what order the county groups would receive these surge resources.
Are you familiar with the Old North State group?
I've heard of it. I'm not sure exactly what they do.
Okay, that's a group of African American doctors, and they are also doing testing and whatever. They've been allocated funds to for this program also. So you have not had any communication with them at all. You don't know about them.
I have not had any communication with them at this time.
Okay. So you said you would like to at some point bring testing in-house, the health department?
Yes, ma'am. It's been one of my long-term goals to have a molecular testing platform in the health department laboratory. This would allow us to test for infections like COVID-19, but also to allow us to test for the things that we currently send out, which are many of the sexually transmitted infections. The turnaround time on those is highly variable. On some of those, we wait a week or 2 weeks to get results back, and that, I think, drastically impedes our care of those individuals. If they're symptomatic, we treat them at the time of their visit, but it's some of these infections are asymptomatic, and then we find ourselves a week or 2 weeks behind the ball in terms of getting these patients treated.
Okay. I think that's all for me.
Mr. Chairman, we have Commissioner Perkins Williams next.
Okay, Commissioner Perkins.
Thank you. Good morning, everyone. Dr. Silvernail, I think you're to be commended for the question you just answered from Commissioner Floyd Huggins about testing, a platform for testing. That is a good visionary thought. My questions have to do with the line of first defense. Are those lines set out by departments or groups or whatever, such as I can't think of it. People who get the calls on the weekend or something like that. How do you separate, or do you separate the line of first defense?
Commissioner Perkins Williams, are you talking about EMS workers, CNAs in nursing homes, or what do you, we're trying to figure where your question is.
I have used the, what's unusual? Oh, I've used the trash dump a lot since I've been taking my own trash, and I don't have a pickup. That one, and also there has been some situations where the deputy has been called for trash as well. I have gotten, for some reason, a lot of questions relating to that. So that's what I was trying to find out is, are there different lines or different groups of people within Pitt County government who will be considered as first line of defense and maybe left out some other times as a first line of defense? That I just wanted to bring attention to that.
At least for the health department, I'm available 24/7. And if they can't find me, they have my deputy director's contacts, but it's rare that I'm unavailable. My personal cell phone did meet a unfortunate incident over the weekend, and we're working to get that repaired or replaced. But I do have my county phone, The 911 center has called me on after hours multiple times and has been able to track me down. And then I'm able to reach out to my staff as needed to take appropriate action under the circumstances. Sometimes things can be handled by myself, and sometimes I need to pull some of my staff in, but we are available after hours if needed.
Thank you, Dr. Silvernail. Since you answered that question, and while you're at the podium, I'd like to ask another. There's not very much been said as it relates to tracing, and because I have two medical people very close in my family, tracing is a very key factor in communicable diseases. There's not very much said. If we have an outburst, isn't tracing a key factor in this?
It is. I think the most important part starts with the individual, and that if you know you're sick, not to expose others, and to stay home, get yourself tested or treated as appropriate. The other thing we have found is with most of these, we've done it right on this one. If folks were tested, they were in isolation, we have generally found the contact traces to be very short. With most of our COVID-19 cases, we have had some clusters, like the one that you brought to my attention last week. But those clusters tend to be within family groups or extended family groups. We've been fortunate to not have a large employee outbreak in our community. But I agree, yes, we do need to, as we move into sort of the back end, hopefully the back end of this epidemic, that as cases pop up, it's important to make sure that we control the spread around those cases and try to get in front of this. This is it's a communicable disease, a transmissible disease. We are the reservoir of it. And it's likely going to be with us for a long time to come. So when we do have cases, it's important that we identify those cases early, we isolate those cases early, we control the contacts, test the contacts appropriately. One of the things that we do sometimes struggle with is getting people to answer our calls. You know, everybody has caller ID on their cell phone these days, and I don't know if they're afraid to answer. I think it comes up as Pitt County government. So if you can help us in any way with that, in terms of speaking to your constituencies and saying, hey, when you get that 902-2300 number, that's the health department, and they really do need to talk to you, that can help us in those contact tracing efforts.
Yes, thank you. But I know of some other groups that had some events, and some of them don't know that with the one that you spoke of, they knew that they were positive. But there are some other groups that have group events. And then in an effort to keep me mentally whole, I rode out on Monday and we took quite a tour out, and there were churches with packed parking lots, and there was no one seen, so they had to be inside. Those are the kinds of things, as in physical seeing of a potential outbreak, and they may not know that there may be someone there who tested positive. So this is why I wanted to bring up tracing and monitoring or whatever. Most time people are embarrassed to say they have a party. And but I do know that there are some that exist, especially you get the invitations. So that's I think it would be good not only to know about the people who come from outside to be tracers, as you referred to with Commissioner Huggins, and then I have friends who in the old TAR state medical league, but that bothers me because if the tracing isn't done, you may not know where those people go, and the potential of going to a neighborhood and infecting the neighbors can happen, and the people may or may not be on the invitation list. That was something that concerns me. The next thing I have on my list is, what is the criteria for tracing from the state? How do you access that? And is there criteria to access the state's tracing? Since we're in Region 3.
Yeah, I'm not sure which one of the contact tracing regions number we are, but there's a regional coordinator, and those staff will be made available to us through that regional coordinator. There is a request process for that, which the state has not completely specified yet.
Okay.
They're going to start with the larger areas. Mecklenburg, I believe, is one of the first counties. Some of the counties in that area, and then move to the Triangle, and then move to the Pitt County and surrounding counties. I believe it's in the third region that will receive tracers.
So you will have access to that.
Yes, when the
Good.
state makes
That's all I want to know, because your phone is close. And I thank you. The next thing I want to know is, did the county, let me go stay with schools, because the next one's going to be for Scott. The schools, have you been in touch with Superintendent? I got to get his name right, because I have a code name for him. Linker. I don't want to call him Liquor. Are you in contact with Superintendent about the schools and their opening?
No, ma'am, not in terms of their opening, but in terms of their budget requests, and also in terms of their allocation of COVID dollars. They've been allocated $8 million of COVID monies to use as the school system per the requirements of the state and the feds. But in terms of school opening, that's a school board matter that we don't really interface with them on in terms of that matter.
Well, what I was bringing it up, because people are concerned about their children, and the people are concerned about the expectations, and some would like to plan ahead. That's why I keep bringing up school. I know, having been on the school board for 6 years, that we have no direct effect other than allocating the funds, but communication is the key to a lot of things. And as long as people know, then they will feel comfortable in doing what we say.
We actually met this morning with Dr. Linker to talk about budget and to talk about even their COVID allocation of dollars. So we are in constant communication with.
Okay, that's all I wanted to know, because when they say, I can say that the county did it. Not that I'm trying to cause anything. I just want to be proactive rather than a reactive to a situation, and people get panicky. My invitation to municipalities to join this meeting was that invitation included with this?
For
That
today's
they
special.
can hear our discussion. This was the next question.
No, ma'am, but we did post this as a special called meeting as required by general statute. So they more than welcome to tune in if they so chose.
Okay, this is aired on 13.
This is aired live on YouTube, and I believe this would be a live on channel 13 as well. Yes, and will be replayed.
Okay. I just want to know, just in case that becomes a discussion.
Sure.
I thank you very much, gentlemen, and I appreciate your patience.
You're welcome.
Commissioner, if I might, Dr. Linker and I are on a first name basis, which started in the fall with some immunization issues. And we have been working together on his graduation plan. And I'm sure as he moves into his reopening plans, he will engage me for that, and we will work with him to help with that and provide any technical assistance that he might need.
Thank you, Dr. Simonell. That's a good added note.
Okay, Mr. Chairman, we have Commissioner Ward next.
Okay, Commissioner Ward, thank you. Commissioner.
Thank you very much. I've been writing questions down in comments, and I've been also crossing them out as my forward-thinking commissioners have almost spoken to everything that I had a question or a suggestion for. Dr. Silvernell, thank you so much for what you've been doing. One of the things is I'd like to just hear real quickly how you would feel about additional money to get more testing done quicker in the county, part of this money. Do you think that's required, or do you think they have a plan coming down where we would not have to use this money for that?
How could I work in government and say I would deny money? So as I said, the state guidance to us, Commissioner Ward, is that we should test about 5% of our population per month. So if we're roughly 200,000 people, it's about 10,000 people a month. Comes down to about 334 folks a day. We're probably somewheres around 150 a day between all testing sites, maybe a little bit more. It's hard to tell right now because we don't get all the negatives. We know we're having trouble getting our negatives. In fact, in our data, we're probably 1,000 or more negatives short right now. That's another story and a discussion for another time. In terms of supplementing that capacity to get us to where the state wants us to be at that 5%, the plan that we have right now is, I think, will get us there. Will get us that at least that testing capacity towards that 300 plus tests a day that we need to do in order to test about 5% of our population per month. Now, I'm not sure how many months the state expects us to do that, because that cost, if you look at that cost going forward, that becomes a monthly cost. And again, if we're going to need to continue to do that testing on a monthly basis, we probably do need to move to having some sort of point of service test. That's what we call a molecular platform test, to do some of that testing or all of that testing in-house to make sure that we're supplementing what's going on in the medical community and hitting those vulnerable populations that we need to hit that have limited access to medical care and testing. So would I turn down more money? Of course not. But I also want to be fair. I know the county has other needs, and some of the messaging things that's woven into the things that we do every day in terms of our public health messaging, and certainly we can do more of that. But I hope that answers your question. If not,
if I can add to that, Dr. Silvernail, we kind of did this back of the envelope calculation last Friday, but in order to meet that 5% of the population, which is about 334 people per day being tested, and if you have about 150 currently being done by other medical facilities or providers, we'd have to test about 165 people ourselves per day. And the cost on that the health department put forward was about $130 per test. So a per day cost would be $21,450. If you did it through the remainder of this calendar year in which COVID funding is eligible, that's about 210 days. You're talking about $4.5 million just to test 165 people a day to get to that 5% of the population. And keep in mind, we only have an allocation from the state of $3.2 million rounded. So just trying to put this in the big picture to even meet a 5%, which I mean, I think we said that the state is recommending 5%. The CDC was maybe recommending 2%.
I think the federal government is 2%. Yes.
Okay.
So,
am I still up?
yes, ma'am.
Okay, that answers my question. Let's just continue on with what we're doing, I think, because monetarily it sounds impossible to do the whole group and just do it in increments as suggested. Since the funds, if I understand this correctly, that we're talking about can be used in any way, so to speak, as far as if the county determines it. And I tried to jot down a lot of the ones that you went over, Mr. Manager. And what I think we need, and I like the suggestions that a few of the commissioners made. And what I'm thinking is that I'd like for the staff and the commissioners maybe to support this, for them to go back and consider the suggestions that have been made and have them inputted where they can. I'm not sure, apparently, I don't know exactly. I think the towns on that report you showed us, the variance, you said $700,000 for Grimesland, but I think it was just $700. And then another one had a very small double figure, and then we had an up in the millions. So I think we're going to have to look carefully at dividing up with the municipalities and that sort of thing. But I think that what you put up there as suggestions and some of the suggestions you've heard today, what I'd like to see you do is to kind of put some of those together and have those suggestions brought back to us at our meeting on Monday in June. And I like the fact that it is fluid. In other words, if we agree on that plan the next week, if there's something that comes up and we need to shift that around, if I understand it correctly, that's what we can do. So I'd like to just make that suggestion with all of this information we've got today. Thank you.
Thank you, Commissioner Ward. Mr. Chairman, next we have Commissioner Albright.
Yeah, just real quickly for Dr. Silvernail, what do you think the timeline would be and the cost for setting up this kind of wish list lab that you're talking about?
That's a good question, Commissioner. One of the options out there that recently has gotten some bad press is the Abbott device. The Abbott instrument itself costs around $5,000. The reagent cards we estimated were about $45,000 for the actual reagent kit to do that. There's high demand for that product right now. There are some other products coming on the market. There's we do a lot of our supply work with Henry Schein. They've made us aware of a system by Quidel, although we haven't seen the performance characteristics of that. So depending on the instrumentation, that instrument for the capacity, we might need somewhere between $5,000 and $20,000 maybe for the instrument. It's just a ballpark guess. And then the reagents or test kits, test units for that, probably somewhere in the $40 to $45 range or more for that. We would like to try to drive that cost down. As I said, right now we're about $100 with LabCorp per test. I don't know that we could ever have a large enough system to drive that cost down to match a state lab or a big hospital lab. But going forward, that system hopefully could be adapted to also do some of the other testing that we need in our laboratory.
And about how long would it take to get something like that up and running?
Conservatively 90 days. You know, as a guess, most of these instruments are in high demand right now. At one point, the Abbott device had there was a 7,000 person wait list for the Abbott device, and the federal government was deciding where those devices went, and they were being sent to the most heavily impacted areas around the nation. So on many of these devices, there would likely be a significant wait time to purchase one and have it installed, and then to do the quality control that needs to be done with a new device like that in a laboratory.
How about collaborating with another health department to defray cost? Is that feasible? Or I don't know, with Vidant, is it possible that we could do this in a way that collaborates with other agencies?
Potentially. Vidant has built platforms and has been trying to increase their capacity to test in-house. And they're hoping to be able to dramatically increase that, but they are struggling with the reagent side of this. So their supply issue has been having the reagents to actually run the tests on their platform. And then they're having some differences reconciling the performance characteristics from, I believe they have 4 different platforms in their laboratory now. And again, I don't speak for Vidant, so I don't want to comment too much on their system, but I know that their capacity right now is limited by availability of reagents.
Thank you. And thank you very much again for the good job you're doing for us.
You're welcome. Thank you, sir.
Mr. Chairman, next we have Commissioner Colson, Vice Chairman Colson.
Okay, Commissioner Colson.
Yeah, it has to do with cost. My personal opinion is we shouldn't give any money to any of the cities or towns at this particular point. It's been mentioned that the testing is going to be very expensive, but all these towns and cities are going to be able to benefit because their citizens also fall under the testing category, as I understood a little while ago. $3.1 million is not very much money when you have it for things like this. And the fact that the state's holding back 50% of the money, another $150 million out there, who knows what they're going to do. Scott, you'd mentioned that one of the things you might want to do is to actually go and see something about the city making a request when you send this information into the state. Well, I personally think you shouldn't do that. I think the city should do that. They should make their own case. If the city of Greenville were to get money, would they be sharing it with us? Well, I kind of doubt it. And maybe for good cause, because they would have expenses that would meet whatever monies they get. Dr. Silvernail, have you finished your plan for potential reopening?
I have been able to complete some of it, Commissioner, but it is not completed at this time.
When do you expect to have it completed?
Certainly by the next Board of Health meeting.
Okay, well, it's still several weeks away then. I would think that whatever you come up with, that there's going to be costs associated with that. You may be recommending that certain businesses do certain things and so on. Would we be guiding these businesses as to how they would reopen? And would any cost there, would that fall into the category under this $3.1 million?
We would provide guidance and technical assistance. I don't know that we provide support to them, and that decision would not be mine to make.
Yeah, I don't think you'd use these dollars for the private businesses for signage and PPEs and so forth. It'd be more of the public response. I want to point out too, Vice Chairman Colson, there are FEMA dollars that Pitt County government as well as municipalities can seek in terms of, I believe it's public assistance, Brian, the PA category, above and beyond this allocation of 3.1 million. But this is not the only pot. You want to expound upon that?
That is correct. FEMA has set up SHOP to allow all municipalities, very similar to when we go through hurricanes, with the big difference being with this event is ongoing. So FEMA has set up the ability to submit reports as you go. So any money that we're unable to send to municipalities via this 3.1, they can, if it's a FEMA designated reimbursable item, request reimbursement through FEMA through their own normal channels.
Okay, so Beth made a request that things that were offered by the various commissioners that it be brought back June the 1st. Well, that's our next meeting. Would you have enough time to be able to respond later that day to the state? Or it would seem to me you'd need to have something more agreed upon by us before June 1st. I think it'd be rushing you if you wait till June 1st. What do you think, Scott?
Well, I think we have a pretty good plan laid out right now. We'll go back and tweak this as staff and bring back to you a final recommendation for June the 1st. And then again, if there's not 100% agreement on what this plan looks like come June the 1st as a board, just keep in mind, we can amend this plan and send it up to the state, and they've indicated flexibility in use of these dollars per the categories. So I wouldn't feel like you're being totally locked into it, other than the majority of how the board wants the funds spent, unless you were to amend that.
Well, I'm at a disadvantage in the fact that I'm not able to see the slides or whatever you had, and nothing was sent to us, ahead of time to be able to look at it. But I seem to remember you saying something like 25% of the money that you were breaking down into various categories was going to go to the various cities. Did I understand that correctly or incorrectly?
Only 15%. We had 25% as a contingency for unforeseen for future, but only 15%, 178,000 would be municipal.
Okay. Well, I'm not sure that I'm not sure what we have actually told you to do. I mean, listen to everything. I don't know how you're going to modify it based on what we've said. I'd be really curious to see that. I'd like to see it before June the 1st, before the meeting. Is that something you can put together so we can physically look at it?
Yeah, you probably would have this with your agenda package tomorrow as it goes out. So yeah,
All
we
right,
would tweet.
that's good enough.
Okay.
Okay, I'm good with that. Thanks.
All right, Chairman McLaughlin, we have Commissioner Floyd Huggins again.
Okay, Commissioner Huggins. Commissioner Huggins.
Yes, Mr. Chairman, back to Dr. Silvernail, I believe, when talking about the, and Scott also, testing. I'm sorry to keep hopping on testing, but that's where my mind is mostly on testing and PPEs. What you have proposed, tell me again what percentage that is. And I know you said that I think the federal or either the state is requiring 5% of your population. Tell me what you're proposing, what percentage of the population you're proposing to test. Tell me that again.
Well, again, the guidance from the state, I believe, is 5%. And the guidance from the federal government is 2%. There's no requirement for either one. Dr. Silvernail can correct me if I'm wrong there, but in terms of total number of tests, we're saying that we could accomplish for $438,000, or 20% of the total $3.1 million won't begin really to touch 2% or 5% of the total population. Dr. Silvernail, you want to?
Going forward, no, the state is recommending that we test 5% of our population per month. So that's about 10,000 people per month. So roughly 334 people per day. We estimate that it currently in the county, when we look across all the places that are doing testing in the county, that we are probably somewhere around 150 or over tests being run per day. Again, we know the state no longer requires the submission of a patient under investigation form to us for people being tested. So our total testing number is a bit nebulous, and we've had some issues in getting our negative numbers, but we estimate that we're probably 150 or more tests being done currently in the county. The testing plan that we've put forward here with 2 fixed sites within the city of Greenville that could be moved as demand changes within the city. And then one more roving site to cover the rest of the county. The capacity of that is roughly 150 people per day, assuming that it was fully utilized. And that would put us somewhere north of 300 people per day on the weekdays. We know the weekends would be less. Initially, my nursing director drew up a 6-day-a-week plan. We generally don't staff on Saturdays for things. We could if directed to do so. But that was a Monday through Friday testing plan with hours from, I believe, 9 to 4 at each of these sites.
So the 20% of the $3.1 million or $638,000, we could accomplish in only 1 month. Could you meet the 5% standard recommendation of the state for the amount of money being allocated at 20%? Again, it's about $643,000, $644,000 per month times 7 months. You're at $4.5 million. But a 1/7 allocation of that for the month of June, the $643,000, $644,000 would pretty much eat up the 20% set aside in this pot of money we're discussing this morning. If you theoretically, if you did all those in the month of June.
Okay. I'm trying to get in my mind to a percentage that we could shoot for. I know the 5% is out of our range according to the money we have. So that's what I'm looking to I'm looking to see what we could set a goal of what percentage of our population that we would try to test.
But if you did 2% versus 5%, if you spent half of this 4.5 million to do 5%, so say take about $2.2 million to do 2%, you could do 2% of the population over the next 7 months using these monies at about $2+ million.
Yeah.
If my math is,
Yeah, so 2% is about 4,000 a month. Divide that by 30, that's north of 120 a day. So, that would extend the length of time that you could continue that testing effort from a county standpoint. And again, all of the testing that goes on in the other medical systems in the county would still be in place and still be there as part of that capacity.
and I think another thing we might want to bring out too is, who are we testing? Today, only people who have signs of COVID-19 symptoms are tested, versus this platform, would it test those same type of people, or would it expound upon that?
This would be testing for anyone who wants testing.
I would hope that would be the case.
There-
Yeah.
No requirement for a prescription to be tested. This would be, if you wanted to be tested at the site, this would be you can be tested at the site. The testing criteria has been very broadened very much by both the federal and state authorities, now allowing for testing of almost anyone. There's still not a general recommendation to test asymptomatic people. But again, if we're looking at a congregate living setting like an apartment complex, which is not really a congregate living setting, but sort of a quasi-congregate living setting, that testing people in that setting, it would seem appropriate to me. And there would be no requirement for symptoms or prescription on these testing at the county-run sites. The other thing we realize, that being open 9 to 4, while that's conducive to the business workday of a government employee, it's not necessarily conducive to the work requirements of the general population.
Right.
We have a late clinic on Tuesday evenings, which is well known in the community at the health department, and the plan includes having testing available as a drive-up, walk-up type facility at the health department on Tuesday evenings during those late clinic hours for individuals seeking testing after the 4 p.m. cutoff.
And if you move it out within the county, or then those hours could be later than 4 p.m. Don't you think? That would be more suitable for the community?
For the roving unit,
Yes.
we could adjust those based on demand if we find that we're having a demand. As the plan was drawn up from a staffing standpoint, it was drawn up as an 8 to 5 plan, as is the typical county workday. But again, we're first responders. We can adjust those work schedules. My staff might not be happy to hear that, but if there's a demand for later, then we could start later and work later, so that we don't incur overtime costs. And sometimes on the early morning end, you may be slow and you may be busier at the end of the day. We're not sure how that demand is going to flow. So the plan as presented, I would see as a concept, and that we would fine tune it once it's operating to provide the best service to the community.
Well, I would like to see us plan to try to test 2%, to move toward trying to reach a 2% of our population. And I don't know if that would, I said earlier that I would like to see 25% of it used for testing, and leave 20% in the contingency. So I don't know whether that would make out to 2% or not, but that is my recommendation. Thank you.
You're welcome. And we will look for a more cost-effective testing option, but at least out the door, we're going to need to use the commercial lab at LabCorp to start out with, and we will pursue more cost-effective options. Although all labs, even though their capacity is better, would struggle as every community tries to ramp up the amount of testing they do.
Okay, Chairman McLaughlin, we have Commissioner Ward.
Okay, Commissioner Ward.
Okay, thank you very much. I really think that the our county employees have done a remarkable job with this presentation. I think the suggestion list that they gave was very good. I think that they can hear from the commissioners, just like what Commissioner Huggins just said, her suggestion. I think Chris had some, Alex had some. And what I would like to propose is that, and I don't know whether it needs to be in the form of a motion or not, maybe not, but that we have our group that came up with this plan meet between now and Monday. And well, actually, if we can get it in our packet on Friday, that would be great. The proposal with some of the tweaks, it doesn't have to be all of them, and it doesn't have to be the amount or the numbers that we have proposed, but we would look for you to make that decision to bring the plan to us. Now, we can approve that plan that first, at our meeting on Monday, but because let's remember, we don't usually get an opportunity where a plan is fluid enough so that if something else comes up, we can just make that change or shift the money around. So I think I want us to get our plan into the state as soon as we can so that we won't lose that money, we'll have that money, and then we can keep working on it and have the group for what benefits Pitt County the best. So I don't know whether, I don't think I need to make a motion for that, but I'll be glad to.
Mr. Chairman, if you'd like a motion, or we do have Commissioner White who wanted to speak again as well.
Okay, Commissioner White.
Yes, sir. Thank you. And this might have been in the slides today presentation. It might have already come up. But since I called in, I can't see it. So I apologize if this is a duplicate question or comment. But you did say that we could use that money for staff salary who have responded to COVID-19, correct?
Correct. The way it reads, if you've spent a substantial amount of time on the COVID-19 response, the county could be reimbursed, say like for Dr. Silvernail's salary for the past 2 months, to reimburse the county.
Yes, I would kind of like to see something like that. I think that would, in the long run, help everybody in the county, all citizens and taxpayers, because, I think everybody has been greatly affected by this. So I would kind of like to see, and it may already be in there, so I apologize if it is, but I would like to see some salary reimbursements for Dr. Silvernail and other people who have spent a significant amount of time responding to this.
Okay, we've noted that and take that into consideration.
Okay.
Mr. Chairman?
Okay. Is that it?
Yes, sir. That's all we have. No more hands raised at this point.
Yes, sir. I want to just comment on Commissioner Ward's possible motion. I think that you heard those comments clearly from all of the commissioners, and that you're going to, yes, you and the staff, along with Brian Barnett and Dr. Silvernail, is going to come and do the best in terms of bringing this back to the commissioner at the next regular meeting. So I think we can move forward with that. I think that was the consensus of what was said, and I think you mentioned that. One of the things that bothers me, and I don't know how this came up in Belleville, it was only like $321, and you can almost cost more than that to take a cab from Raleigh to Belleville. I don't know what they can do with $321. That's something that's in a rural area. That's something that I think that we might want to just look at in terms of what could be done to, and if $321 for Bethel is all they need, I just don't see it. But there again, you can look into that again, Scott. But I want to thank Dr. Silvernail, Scott, and Mr. Barnett, Bryant, for your fine presentation, your thoughtful presentation, and all that you did to put into bringing this to the commission. And I think you all did an excellent job. And we're certainly going to look forward to you bringing that to our regular meeting as to a path forward. So thank you.
Thank you, Mr. Chairman. With that, Mr. Chairman, that is the only topic we had on the agenda today that we advertised for. And we will take these input and comments by the board and meet. And like the board has asked to bring back a revised recommendation at your regular meeting on June the 1st. And you should have these in your agenda package that we publish tomorrow or possibly Friday.
Very good.
So,
if there's no other
motion to adjourn.
Okay, concerns, we ask that the meeting stands adjourned. Thank you very much.
Thank you.